With the president on board, Marine One took off from the White House Tuesday afternoon. But despite protocol, air traffic controllers had not stopped flight traffic at Reagan National Airport. The FAA and NTSB are now investigating why.
Tower, that's Marine One proceeding as briefed.
One, you got traffic rotating off runway 1, E170.
Marine One, visual traffic.
Marine 1, roger.
One will be doing a momentary delay.
Video shows a commercial jet taking off at 2:35 p.m. Then, a short time later, you see Marine One flying into the area over the Potomac River. The FAA says the flight paths were not on a collision course, writing, quote, "There was momentary loss of separation, after which the aircraft continued to move away from one another." The air traffic controller was in contact with both the commercial pilot and Marine One pilot during the loss of separation. A White House spokesperson adding, quote, "Marine One flights are piloted by some of the best aviators in the world, and at no point was the president in harm's way." The FAA tightened up the amount of air traffic near Reagan National Airport after a deadly mid-air collision last year. That happened when an Army Black Hawk helicopter collided with an American Airlines regional jet, which had been cleared to land at the airport, killing 67 people. The Marine Corps calls Tuesday's flight routine and says air traffic controllers approved the requested route. At the White House, Jared Halpern, Fox News.
As the world waits to see whether an agreement over the Strait of Hormuz comes together, President Donald Trump is forcefully pushing back on concerns about the stockpile of weapons in the U.S. In a post on True Social after midnight Thursday, Trump insisted that the U.S. military has, quote, massive amounts of munitions. He said that more is being made and sent to the U.S. This follows reports from CNN and others about concerns being expressed within the military community about the supply of weapons in the U.S. being depleted as the U.S. has continued to strike Iran over the last 5 months. Meanwhile, Iran is signaling it could be on the cusp of a deal with Oman over a temporary route for commercial shipping in the Strait of Hormuz, but it's insisting that any potential agreement does not mean that the strait will be fully and immediately reopened for all. And we're learning new details from Iran's deputy foreign minister on what he says Iran wants to see from the U.S. for the strait to be fully reopened. He said Iran wants to see the U.S. end its naval blockade on Iranian ports, ease oil sanctions against the country, and negotiate over Iran's frozen assets. He also said he wants to see the U.S. address instability in Lebanon. This has been a major sticking point for Iran throughout these talks, and we've seen it hasn't been an easy topic for the U.S. to address. Just this week, we've seen renewed Israeli strikes in southern Lebanon, despite a U.S. brokered ceasefire in place. At the White House, I'm Maddie Gannon.
I'm gonna stay away from the, any kind of vegetables at, restaurants and stuff like that.
Consumers expressing concerns about where they get their fresh produce amid a growing outbreak of cyclosporiasis tied to lettuce.
Just try to watch what we're eating, make sure we're washing everything.
Health officials have linked the outbreak of the intestinal illness to lettuce sold at restaurants such as Taco Bell and some grocery stores. According to federal health officials, the outbreak now accounts for cases across 15 states. This after 6 states were added to the list, after lab testing showed illnesses there were likely caused by the same strain of the tiny Cyclospora parasite. The parasite burrows into the lining of the small intestine. It can cause weeks of severe, debilitating gastrointestinal symptoms if left untreated. Some consumers are opting for alternatives when it comes to where they get fresh produce.
I feel more comfortable taking from a local farmer than from a supermarket.
Local farmers tend to agree.
Growing local and having it directly fresh out of the ground here. We're not shipping it, so it has no contamination.
The CDC has tallied more than 6,000 cases in the outbreak. Nearly 300 of those cases resulted in hospitalization. 2 people have died. I'm Reed Binion reporting.
I don't think we really had enough time to learn about our new district that we're in and the counties that we're sharing it with and what all of that means. So I think it was alarming, like the pacing and the speed of it.
I think the minority voters down here, they pulled that away from us there. We only had one district in the whole state of Tennessee, and you don't even want that to be fair? I mean, it's just terrible. I mean, I love this state, and but I am very disappointed in our governors, and especially that whole chamber up there, felt like it was not important enough to have one district for the minorities. I can't understand that.
From a democratic standpoint, we have to come out and vote. We hadn't been the best to come out and cast your ballot, so you can't complain. I always heard that. You can't complain unless you come out and cast your ballot, right?
And so while I really wasn't in favor of the redistricting, we had to try something. And I hope it works. I hope that we get more competent leadership here in Shelby County and to bring some goodness and some good statistics back.
Tennessee Democrats are going to have a much harder time gaining power and have a much harder time kind of forming a united front, especially divided across 3 different districts now.
It's an awful decision. It's a sign of weakness and an absolute disaster for the state, because it tells me that they're afraid of losing the election, so they are rigging it, gerrymandering, whatever you want to call it, in order to gain an advantage.
Our issues in Memphis are totally different from somewhere in Middle Tennessee, right, or East Tennessee. So, yeah, it definitely makes me a little nervous to know, I feel like Memphis might get a little shafted in services and funding. So definitely, I'll be looking more into that.
President Donald Trump's administration on Thursday revealed plans to overhaul Head Start, a federally funded program that provides early education for the nation's poorest children. Officials from the Department of Health and Human Services say the proposed changes would encourage more local decision-making. Early childhood policy experts argue the deregulation could undermine Head Start's position as the gold standard in early education. Head Start centers serve around 700,000 of the nation's most vulnerable children, including those who are homeless, in foster care, or disabled. That is not set to change. The proposed plans include eliminating most of Head Start's regulations, such as standards for low staff-to-student ratios or requirements to provide services for preschoolers' families. Centers will have the option to continue operating as they do. However, officials say they will have to adhere to at least 2 new requirements. Those requirements being a 5% cap on administrative expenses, down from 15% under current rules, and new nutrition provisions championed by Health Secretary Robert F. Kennedy. The public will have 60 days to weigh in before changes can be made. The final rules could face legal scrutiny, further delaying their implementation.
Money is delaying Gen Z's path to independence. Back in 1975, nearly half of young adults were living on their own, working, married, and had a family. Today, that has dropped to just 1 in 5. And nearly 3 in 4 Gen Z adults say financial challenges have forced them to postpone at least one major life milestone.
Over a third of young people believe that they'll never be able to afford a home. And about 1 in 5 young adults today believe that they will never be wealthy enough to afford to have children. That is a scary thought, considering we're not just changing our timeline, it's generally questioning whether or not we'll be able to achieve those milestones.
Gen Z accounts for just about 4% of home buyers today. That compares to baby boomers at 42%, Gen X at 25%, and millennials at 26%.
There have been huge economic pressures, and especially among a generation that was of prime home buying age during the pandemic, they didn't hit that benchmark. And I think it's left many young people feeling that the system is rigged against them, that they've been locked out of the American dream.
When it comes to the cost of living over the last 6 months, a recent Fox News poll asked voters under 30 how much financial hardship inflation has caused them and their family. Nearly 40% said yes, a serious hardship, and about half said yes, but not a serious hardship. Gen Z and millennials aren't just sitting on their hands, though. On average, they're starting to save for retirement at the ages of 22 and 28, respectively, years before their boomer parents and grandparents.
We try and make the dream attainable, and it starts with working backwards. So when we start with that end number in mind, we identify, okay, here's how much we want to save per week. Over those weeks with a consistent plan, we're able to save thousands of dollars, if not a small percentage, to put towards a down payment on a home.
The big question of AI's impact lingering over all of this. Nearly half of Gen Zers and a third of millennials say they are pessimistic about the potential impact of AI on their careers. In New York, Lauren Simonetti, Fox Business.
U.S. jobless claims ticked up last week. The number of people who filed for unemployment benefits was 199,000 in the week through August 1st. This comes a day after ADP reported just 44,000 new jobs created by private employers in July. The UK government clearing Paramount's $81 billion acquisition of Warner Brothers Discovery after Paramount offered editorial protections. Paramount agreed not to consolidate UK television channels and streaming services. The deal still faces substantial legal challenges in the U.S. Warner Brothers' profit narrowed in the second quarter. Do you miss the flair of a flip phone? Well, they're making a comeback. Samsung's new foldable phones shattering records with massive pre-orders in the U.S. and South Korea. There's a $2,100 price tag for the Z Fold 8 Ultra, nearly $1,900 for the Fold 8, and $1,200 for the Z Flip 8. The fascination with old-school cell phones isn't new. It comes amid reports Gen Z is swapping smartphones for vintage phones like a Nokia or Motorola Razr. And Pedialyte is ditching colors. The brand's lineup of drinks, freezer pops, and powdered packs are all going dye-free. Shoppers will see Pedialyte's classic and color-free products at stores together through the transition. CJ Papa, Fox News.
They're fun to ride and can get you where you're going more quickly, but electric bikes and scooters are not the same as their counterparts that don't have a motor.
Largely, there is a huge disconnect in information. I think that's where all of these issues are leading out to.
Pediatric emergency medicine Dr. Purva Grover with Cleveland Clinic says the past several months she's seen a spike in tragedies for children from e-bikes, but it's a problem nationwide regardless of age. The latest data from the U.S. Consumer Product Safety Commission shows that between 2017 and 2024, there were an estimated 155,200 emergency room visits due to e-bikes. There were also 310 deaths reported. In that same time period, e-scooters sent an estimated 380,000 people to the emergency room, but Grover believes the numbers are severely underreported.
I fear that what you are seeing right now is just the tip of the iceberg.
Grover says to always wear a properly fitted certified helmet that's tested for higher speeds. She says a regular bicycle helmet may not provide adequate protection, and follow local traffic laws. Large vehicles have blind spots and may not see an e-bike or e-scooter.
These are 50 to 60 pound big machines which can travel at a speed from anywhere from 20 to 28 miles per hour and can cause significant injuries.
For Health Minute, I'm Mandy Gaither.
Burn specialists tell us that they're seeing an uptick in the number of patients rushed to emergency rooms with severe pavement burns. Specialists emphasize that this can happen to absolutely anyone, and this risk is much higher this time of year.
Out there like that, it's just like a frying pan.
Every single summer, local emergency rooms are flooded with patients seeking urgent care for severe surface burns.
Just a couple of minutes of contact will give people a very deep third-degree burn. For example, we had a recent day last week where we took our thermometer out and the day was 106 and the pavement was over 160. Those kinds of temperatures can cause burns within seconds.
They escalate rapidly, especially in the Las Vegas heat where triple-digit temperatures bake the asphalt to scalding temperatures.
So pavement burns can progress to third degree very, very quickly. So that means through all of the layers of the skin.
We've had some people who've unfortunately passed out and have been on the surface for 20, 30 minutes.
At burn centers, the demographic of those affected can vary widely. It can affect the homeless as well as pedestrians.
And then there's a lot of several a month we see where people have tried to run across the pavement so they burn the bottoms of their feet off.
Hospital officials say the pattern is concerning.
There seems to be an uptick this year, I will say.
In July, Sunrise Hospital reported 27 case admissions in July alone. And over at UMC, that number was 26 for the exact same reason.
So I expect that we'll break our record.
Medical intervention for these severe surface burns can involve intensive surgeries and complex skin grafts to aid in recovery. Surgeons agree that seeking immediate medical attention is absolutely critical. And remember, while many burns are accompanied by intense pain, third-degree burns often destroy the nerve endings, leaving them completely numb. It's also vital to keep an eye out for different abnormalities that you may see.
The Trump administration's vaccine policy could be shifting. On Wednesday, the FDA approved Moderna's mRNA flu vaccine after months of delays. The agency had initially refused to grant approval, but then backtracked after Moderna promised additional human trials.
The process of approving vaccines involves testing with people, many more people, typically, than you would use to test any other kind of medication.
It wasn't clear if any mRNA vaccines would be approved this year. HHS Secretary Robert Kennedy Jr. has been vocal about his disapproval, and last year he canceled $500 million in funding for vaccines being developed with a new technology.
Hundreds of thousands of people have died due to the administration's vaccine skepticism and public health cuts.
But Kennedy is sticking to his guns and also says he might pull back on recommendations for other vaccines, too.
None of the 8 vaccines that are administered during the first 6 months of life have ever been studied for a relationship to autism.
The FDA approval came just hours after the Senate approved Dr. Erica Schwartz to be the new CDC director.
I believe personally that influenza saves lives and vaccine saves lives. But I can understand why there are some concerns.
Some doctors and researchers are pushing back on that statement, saying the FDA approval addresses those concerns.
The whole reason the vaccine approval system gets put in place is to deal with these kinds of questions.
Right now, the CDC recommends a seasonal flu shot for all Americans 6 months or older. In Washington, Martha Rivera, Fox News.
Your wife is in a bar. You said she's unresponsive.
This is what he's going to tell you.
Trying to find the first place to put a body.
No, sir.
The only thing they could do was kill him.
The jury to find the defendant